Hi guys! Yeah, I just thought I'd do this video on diabetes in hamsters, what to look for. This is all the checklist. And these little stars here is the symptoms that Charlotte had. As you can see, there's quite a lot. Now I will put all these, I'll type these all down in the description so that you can refer back to it. So that you can, because some of these will shock you actually. Because some of these you would never ever have linked to diabetes, so it's shocking. Excuse me a minute. That fan's irritating my chest. Right. Diabetic ketoacidosis. Now I've got Charlotte's report because Claire printed it up for me, so everything's in there. I've had a good look at it, so I know exactly what's what. And so I'm going to go through with this now. These are the general checklist, what to look for, and they'll astound you. They really will. You'll be blown away by some of the signs to look out for. Because usually diabetes, you think of instantly drinking too much, weeing too much, things like that. So here we go. Well, you can see this okay. Raveneous appetite. Now she had a good appetite, but it wasn't ravenous. So, but just look out for that one. Weight loss. She had that towards the end. Towards the last few days, because she was losing the weight at about 1 gram a day. Excessive drinking. Now she had that from for the past 4 weeks. That's why I've been in talks with Claire and everything. Excessive urination. Well, she had that because she was literally soaking her bed. It was just unreal. Now, what's this one? Sweet smelling urine. Now, she didn't have that, but that's another classic sign of diabetes. Hyperactivity. Now, she definitely had that. This is the one which I suspected was neurological, because she had that from day one. If you remember, guys, I said, oh, this one's really hyper. And she had like delirium with it as well. And which I'll come to that in a minute. So hyperactivity was one of the very, 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 very first signs, which you could never connect it to diabetes at the beginning. So guys, if you ever get a baby hamster and it's hyper, it's suffering from an hyper, don't always assume it's diabetes, because it could be just simple that it's full of energy, like I thought. But if it's got delirium with it, like delirious with it as well, and aggression, then if they're all three lined up together, then do seek advice from an exotic vet. So lethargy. Now she had that on the night before, when she became really ill, the night before she passed away. And lethargy is where they've got no energy and they're weak. This one's aggression. Like I said, aggression, hyperactivity, both go hand in hand, and which could be just a temperament. If you see it, like I said, could be neurological problem, but it could also be diabetes. Now in Charlotte's case, it was type 1 diabetes. So aggression and hyperactivity. Delirium. So delirium, that means when they're delirious, usually like if someone has a fever and they go delirious and they don't know where they're coming or going, they start, it's just the brain just stops, they just can't function. Now she had that with aggression and also hyperactivity. So them three put together drew a huge flag for me, because I originally thought neurological problems. Like I said to you guys, because she wasn't taming or anything. And she was just constantly on the go, which now we know now it was her sugar levels and ketones. So delirium, which also can cause fever, because fever sometimes the cause of delirium. Right, excessive nail growth. Now this was another one which I am totally blown away with, because I thought, what? I cannot believe that is on the list for diabetes. Because when I first got her, I after a few days when I did the health check and I found out she wasn't an he but a she, I noticed she had this one particular long claw. It was so long, but I would never have suspected it. No one would, unless obviously you're a vet or something. But I never thought anything of it, so I thought, right, it's going to be hard getting older. So I managed to scruff her, and I just give it a quick clip, and I never thought anything else of it. But it was so long. But I thought, because they're in those tiny little things at Pets at Home, there was nothing to wear her nails down, nothing like that. So I just thought, I'll give it a quick clip. Nothing. But that's another one, another sign, excessive nail growth. Ataxia. Now, ataxia is where they're in a weakened state, where they're weak, they're wobbling. That's a neurological thing which can be caused by blood sugars. It can be caused by a few things, but it tends to be the neurological side of things. So it's like ataxia, where they're weak, they're wobbly, shaky, stuff like that. All these are on. You can research on all these conditions as well. So some of these are caused by other things as well, but in Charlotte's case, they were caused by diabetes. Now, she had ataxia because that's in her medical records. She had delirium, so yeah, she had aggression. Ketoacidosis. Now that's when the ketone level is sky high, and it turns into ketone acidosis, and that means that the ketones are just way off base, way off mark, and hers were so high. I think it was 4 point and plus or something like that, but it was sky high. Dehydration. Now she didn't have that as far as we know, but I think she was heading towards that. Now you're going to say, well, how can she be dehydrated if she's drinking too much water? Simple, it's because if you're drinking too much water, your kidneys obviously have to work that harder, so then go into lumo, so your body's not absorbing the water. No, so she didn't have that as far as we could see. Cataracts. Well, yeah, she got that the night before she passed. That was just basically just within hours that came up. And what's this one? Blindness. So yes, so them two was the night before she passed. That's what made me bring her appointment forward instead of taking her in on the Thursday for the glucose check and everything. Managed to get her in on the next day on the Tuesday. So she had both them. Now, what's this one? Let's see. Bladder infections. Yes, you can get them, but Charlotte didn't have that. Heart problems. She was heading towards that. She was literally heading towards sort of like she would have gone into a coma. A coma if she hadn't been put to sleep anyway. She just didn't have long, and it would have been a slow lingering death. So her heart would have given anyway. And kidney failure. She was definitely heading towards kidney failure because her kidneys were just overworking. They couldn't work proper. Poor thing. So she didn't have it before she died, but she would have done if she hadn't been put to sleep on that day. It would have just, within the next few days, if I hadn't put her to sleep, then she would have developed that. PUPD. Now that one is Polyuria. Polyuria. That means these two go hand in hand. It means it's the proper word for excessive drinking and excessive weeing, actually. It just means excessive drinking and excessive urination. So that one's Polydipsia, and these two are also on but these are definitely linked to diabetes. These two you can do research on as well. These was in Charlotte's record as well, because she written it down, and PUPD when she did all the emergency assessment on that bit. So now we'll just quickly go into the I bet you're quite shocked at the moment, aren't you guys, at some of these signs. So it's very important that you refer back to this. If you ever suspect anything, just never take anything for granted. I don't, not anymore, not since this. This is why I'm paranoid. Every day I'm doing this checklist towards Emery. That's how paranoid I am. So now let's just see quickly, brief. So the ravenous appetite, well, we all know what that is. That's if they're eating more than what they should be doing. But yet again, bear in mind, if it's a young hamster, it could just be greedy. So just keep a little flag round that one, just in case. Weight loss, definitely a big flag, especially if it's a young hamster. Now these, excessive drinking, excessive urination, is definitely PUPD anyway. So if if they're going hand in hand both together, no messing about, take them straight to vet if you can, just straight to vet, and then just take a sample, and then and I'll tell you about how to do that in a minute. Take a sample with you on the day, and then that'll reassure. Then it'll just put your mind at rest, because you'll either know if he or she's got it, or if there's something else going on, if there's an infection going on. So, yeah, just these two will be a definitely very huge red flag. Now, how to do the sample is put them in a clean carrier with nothing in it. Leave them there till they do a wee in it. Then take them out real quickly so they don't stamp in it. The bigger the carrier, the better, so they won't stamp in it. So you can get them out easier. And then when you took them out, you quickly scoop it up with a syringe, put it in a sterile bottle, put it in the fridge. Try and do the sample the night before the appointment, if you can. Then you're not waiting around for them to do it on the actual day, and because you need it there ready and waiting to say it to show the vet, because it will help them, because they can't diagnose really much without a sample, because it'll tell them a lot. So what you do is do it the night before if you can, and then once you put it in the bottle, pop it in the fridge. Just pop it in the fridge, because it's got to stay cold. And then the day of the appointment, don't do it any more than 24 hours. Just do it the night before, and then you just take it out on the just before you set off to the vets. And then when you go to the vets, you just hand it to them so they can just quickly check it. Doesn't take them 5 minutes, and then they'll check it for a few things. They'll check for PUPD, which is which will be if it's excessive drinking and whatever. Then they'll check the ketones, the glucose, infection, if there's any infections. You know the dig. So I hope that little bit of tip helps you. And so done that PUPD. Sweet smelling urine. Now they could add that. I suppose it depends really, because not every hamster will have all these symptoms. Some will have some and some won't. But that is if it's smelling really sweet and sickly. Then, and they've got that alongside the PUPD. Definitely another huge red flag. And when you check the sample, check to see what colour it is, because I didn't know this until I found out the other day. If it looks too diluted, because obviously if they're drinking loads and loads of water, it's going to dilute, then that's another sign as well. And obviously if there's any blood in it, that's another not a sign of diabetes, but that means there's something going on if there's blood in it. So that's why your vet will find the sample very handy, because they can do a host of different checks on it. Hyperactivity. Now this one is, when I say hyperactivity, it doesn't mean like a young hamster being full of beans, because obviously young hamsters, they will be on an hyper, especially females, and not all, but some. But this is when something's not quite right, when they're too hyper, they're not taking notice of you, and they're like, when you're trying to interact with them, they're looking elsewhere, and they're like all over the place, their eyes are all over the place, and they're just delirious, and they just won't let you, and they pick them up or anything, they just don't know you're there, basically, and then if they do like a little bit of a backflip, so, which I noticed Charlotte were doing towards the last few days of her life, the backflip, that's when it really worried me. Lethargy, well, we all know that. If they start to get really, really sluggish, tired, weak, so that's what lethargy is. Then what's this one? Aggression. Well, we know what aggression is. Now, sometimes hamsters can be aggressive, just part of the temperament. Sometimes you just doesn't mean that they've got health issues, or it just means that they're aggressive. They're not known to be aggressive too much, but sometimes you can get the odd aggressive one. And some will have cage aggression. And where if you go to put your hand in or anything, they'll sort of hide, and then when you see your hand, they'll sort of lunge at you, which is what Charlotte was doing for a while. She stopped that after a while though. But Henry does it a bit, which I'm quite concerned about, because he does have a few of these, and I'm hoping he doesn't have the but he's getting checked next week, so I'm not trying to worry myself. Might just be his temperament, because he doesn't have the delirium with it or anything like that, but it's best getting him checked. So the aggression, just put a little flagger towards that, especially if they're getting the other symptoms. But some of these other symptoms, the major one, like the drinking, doesn't usually show up till later on. By then, usually it's too late. But again, it could be totally different in different hamsters. Some might get that first before they get, and it's just. So these are just a checklist just to look out for. So the aggression, which I definitely had a little bit of a problem with Charlotte, definitely, because even Claire, even though she was really weak by the time and wobbly by the time I took her to see Claire on Tuesday, she was still trying to move away. She wasn't aggressive trying to go for us or anything, but you could tell that she didn't like it. But the first time I actually managed to get a proper little stroke of her, because she was just so poorly. So that one should be considered. Delirium, like I said, delirium is where, like in human beings, when someone gets a fever and it goes really high fever, that person will go into delirium. They go delirious, and but also delirium can be an aggression together, can be another sign, which it was sadly in Charlotte's case. Excessive nail growth. Try not to worry too much about that if you've got them from a pet shop, because it might just be. But just keep a little close eye on it. Don't rule it out, because especially then if you give them a quick clip up, but then they're growing faster by the speed of light. Just keep your eye on that one. Ataxia is usually like the very, very late stages. That's when they're weak, they're wobbly, the sugar's way too high. That's when it's affected the brain, neurological condition. It's in human beings, they can explain what it is when they have ataxia. It's because they're feeling dizzy, they lose their balance. But in an hamster, we can only see the physical signs. We obviously don't know if they're feeling dizzy, but we can see the physical signs where they're wobbly and they're just losing the balance. And obviously I've just mentioned that, the ketoacidosis and the dehydration, so we know about them. And if your hamster seems a bit dehydrated and they're drinking a lot as well, make sure that's a big flag. And now, if you are worried, you can go to the chemist as well, and also get some dipsticks, but make sure the ones that include the ketones as well. And then which you could take along. You could take the results along to the vets as well when you go to the vet, so they can explain to you. And obviously, I don't need to explain the cataracts and the blindness, which was just so sad. The eye it just looked such a mess, and the way Claire explained it is like something had burst, and so the cataracts, because it was pink instead of white, it was sort of like some of the blood had mixed in with it, and so it was looking pretty awful, poor thing. And bladder infections, that'll be tested when you take the sample to the vet. The heart problems, well, they'll check the heart for you, if it's an exotic vet anyway. Kidney failure, again, I'm assuming the exotic vet will check that in the dipstick. They'll check the kidney function, but don't quote me on that, but they'll know. Just trust your exotic vet. And finally, I've just mentioned that the PUPD, the Polyuria and the Polydipsia, and they're the ones that was on, definitely, that was on Charlotte's record. So I'll put all these in the description down below, so you can refer back to it. And if you have any questions on these, then just, the dig. And don't worry, if you see the comment, I know I mentioned this many times, if you see the comment switched off, please do, and you really do have a comment to make, you really want to ask a question, don't be put off by it, just come back again, give it an hour or so, because YouTube, they just keep disabling me comments all the time, and I'm getting really tired of it. And I am looking at Patreon at the moment, and for different things. But don't worry, guys, I won't be asking for you to pay anything or anything like that. I'm just looking at some other different ones as well, but I'll still be on YouTube, don't worry, guys. But that'll be a different story. So anyway, any questions, just try again if you see the comments switched off. Don't assume that they're going to be switched off permanently. It's just YouTube, and I do check it. So when I catch them being switched off again, I just automatically put them back on again. So do keep trying until you see the comments back up again, and then I'll try and answer the questions best I can. So all these will be down in the description, so you can print up if you want to, you can write down all the checklist if you want to, and just refer back to it. So you can just basically just keep it. This applies to all species of, even though we know some are not diabetic prone, but these are a good list to have for any hamster, any gerbil, any cat or dog. It just applies. Human beings, they all get these symptoms. So don't assume this is just for hamsters. If you have a gerbil, guinea pig, rabbit, just keep these and then refer back to them if you want to. And then if you want to do some even more extensive research, then you can always fact check it as well, and do like I've done. And also speak to your exotic vet who'll be, I suppose, more than happy to explain things to you like Claire did with me. And so yeah, guys, I'm just trying to think if there's anything else regarding this. I just hope it's been a help to you. because you may not need it now. You may not have a diabetic hamster now. But never get complacent like I did. I thought, oh, it's a breeze. I'll be fine. I've been lucky up to now. I won't get a diabetic hamster. Boy, was I wrong. And it's knocked me for six, because now I'm paranoid. I'm looking for everything. And so it's put me on my guard. I'll also be, later down the line, give me time to work my head round it. And I'm waiting till Emmy gets his results. But I'm working my way down the line of safe diabetic foods for diabetic for hamsters that's literally got diabetes. Now, if your hamster's been diagnosed with diabetes, it's important you find out which one it is, type 1 or type 2. Type 2 usually can be helped by diet management and stuff like that. Basically, just management. Prevention's always better than cure, so if you've got an hamster who's not diabetic, then it's always better to make sure that you keep them to a nice, healthy, low sugar diet. Obviously, they've got to have sugar, but if they have got diabetes, you need to find out which one it is. Type 2 usually can be managed by a diet, but in Charlotte's case, it was type 1, which was type 1 diabetic ketoacidosis, which was, there was another word for it, which I'll have to check her records for it. I should have written it down. But it's either way, it's the 2 words for it. But basically, type 1 diabetes that she had. And been trying to manage it, like, really with diet and everything. You think, when I suspected diabetes and when Claire suspected it. But now that but when she did the test the other day, just before she had to put to sleep, it was confirmed it was type 1, and no diet would manage type 1. Usually insulin's for type 1, but like she said, it's near impossible. I mean, it's just too late to give her insulin and things like that. It's hard giving it to hamsters with injections. But she was just unlucky. It just turned out to be type 1. If it were type 2, it would have been a bit more easier to try and help and avoid and try and manage. But with type 1, it's more to do with the pancreas. It's just not working, and it's just not working proper. And where with type 2, usually is caused by obesity, sometimes genetics, and lifestyle, diet, things like that. So when you change, if they get type 2 diabetes, if you change it and put them onto a special diet which is lower in sugar, then with type 2, usually they can keep it under control. And but hers was definitely type 1. So basically, there was nothing we could do. She was, like Claire said, by her results, which was absolutely shocking. And because she was obviously born with it, that diabetes was there lurking in her body from the minute she was born, really. Even though they say hamsters aren't born diabetic, in her case, the genes was already activated, so it was just lurking and lurking and lurking, but it was giving off the neurological symptoms first. And then when her pancreas was struggling, as the weeks and months went on, that's when these other major signs came up, and that's when we put all the jigsaw together, and that's when it was just turned out to be that, and it's just unfortunate, and it's just so sad. I had so little time with her. And I've got a cute little video. I've not got much video of her, sadly, but I have got quite a lot of photos, so I'll probably do a slideshow one day. But I have got a little video that'll upload, and I've got a few little videos, but like I said, I've not got much, so I'll try and put them all together into one, and try and do another one as well. But the one I've got waiting to upload was sort of an earlier one, just before she started getting the main symptoms of drinking, which where she was in the little taming box and she was running about like you couldn't catch her. She was just, it's like, she was in her own little world. She was just delirious, poor thing. So now I've got this checklist, I know exactly what I'm looking for in the future. Because usually I knew what I was looking for with just the main symptoms, but all these, and there's probably even more that I've not even found out yet. So there might be another video coming along in the future if I find even more. But these are the main ones that the vets always look for and put together. And some of them, like they said, only set in when it's way too late. So it's nothing that it's nothing that an owner has done, it's nothing, like Chloe said to me, I should stop beating myself up, it's nothing that I could have done, it's just nothing. But with Henry, I'm doing the best thing, getting him checked, making sure that if he has got it, we can find out which one it is and try and do something about it. And if he hasn't got it, it's great, but he still needs regular checks just because of the genetics, because of his sister having it. So he'll still need checks. So he's going Monday, like I said, hoping and praying that his results are going to be fine. So I'll just have a little few red flags with him, like the aggression. But he's not got the delirium. So I think it's just more to do with... but he's fine with gloves on, so I don't understand it. So whether he just doesn't like the feel of skin, and he likes the barrier of a glove, he's just a weird hamster. So, but if he prefers gloves, then I'm perfectly fine with that. As long as he's healthy and as long as he's happy, then I'm quite happy to work with him with gloves on. I just need to make sure I get him comfortable at being handled. But it's taken a while with him. But it's not as he wasn't as difficult as Charlotte was, which now I understand why. Right, guys. So this has been a nice long video for you, and I'm hoping that it helps. And like I said, any questions, and just let me know. And you're probably going to think, oh my God, you're probably going to be blown away from all this. And I'm not seeing any other channels that's covered diabetes so much in depth. And I really want to do another video on it, and work around once I've done the research on every single symptom, which I am going to do. So in the future, I'm going to work around this and make it even more in depth for you. But for now, you've got this checklist to be going on with. And if you've got any concerns, try. Always take them to an exotic vet, because if you go to a general vet, they might not pick it all up with small animals. So I'm just lucky that I've got a really good exotic vet that's right near me, and she's just... she just really knows her stuff. So, yeah. Right, guys. Catch you later.